Thank you very much. I hope I'm audible. This is my second time being part of this seminar, and it is such a pleasure to be here. So without further ado, I'm going to be starting my presentation. So I'm going to be talking about harnessing youth engagement to address SRHR, a post-COVID era experience. So what we'll be covering in this session is few topics. Who are the youth in SRHR? What did COVID bring to the table? Personal experiences and posing the problem. So the first question is, who are the youth really? The United Nations defines youth as those persons who are aged between 15 to 24, but this is different in different countries. For example, in my country, the youth is defined as people who are aged between 15 to 30 years old, and it's different in, I'm sure it's different in different countries and in different organizations. It will be very nice to hear your opinions or to hear how your country defines youth. So please feel free to share these things. So as 2018 report, the World Youth Report says that there are about 1.2 billion young people in the world. So these young people face lots of problems today, like substance abuse, unemployment, poor quality education, malnutrition, political instabilities, and all that. But here we are discussing about SRHR, and you might be wondering why. Why SRHR? So how are they using SRHR? Here are some numbers, because I believe in numbers. In God we believe, everybody else bring data, right? So the first one is pregnancy and childbirth are the leading cause of death amongst adults and girls aged between 15 and 19 in low-income countries. Also, complications linked to pregnancy and childbirth are the second leading cause of death for 15 to 19 years old girls globally. So it's the first cause of death in low-income countries and the second one globally. 3 million girls aged 15 to 19 resort to unsafe abortion every year, and 1 in 9 adolescents in sub-Saharan Africa have given birth. I have also present one more data from my country. Everyone should also see and try to reflect on how their country's data correlate youth in SRHR. In my country, 13% of women aged 15 to 19 have begun childbearing. So the teenage pregnancy rate is very high. So having this in mind, what does the post-COVID era, what did COVID introduce to the table? The first one is SRHR services were deprioritized. I would like to say that the COVID era is one of the manifestations of every humanitarian and emergency situations can cause in a specific country or a specific city. Every natural disaster or every man-made disaster can cause just a wide-scale one. So this holds true in every crisis, in every humanitarian crisis. The first one is SRHR services were deprioritized. Definitely, as human resources, as economic resources, as research and everything goes to the COVID, and SRHR, especially SRHR services were deprioritized. The second one is SRHR problems like gender-based violence, teenage pregnancies, and use of contraceptives were increased. The third one is digital movements by young people in SRHR increased worldwide. There's a given fact, and I have heard it being pointed out multiple times, so I will not say more about it, but this holds true. These three things hold true, and we have this in mind as we go on. So I just added this one because I really like talking about what a movement is. It's a state of people with a shared experience of injustice, organize themselves to build their collective power and leadership, develop a shared agenda for change, which they pursue through collective action, system continuity over time, all about movements. So our podcast, Tankwa, which means a small boat in Amharic, to say that it's a safe space. Amharic is one of the languages we speak in my country. So Tankwa means a small boat, to say that it's a safe space where everyone, young people especially, feel safe in talking about their SRHR problems. So it's a pandemic baby. It's born from the despairs of being separated from our target groups. So usually what we do is we go out and we go to schools and we go to shelters and all that, and we teach about SRHR. But during COVID, we were separated from these target groups and we were very much disturbed. Meanwhile, reports on gender-based violence, reports on early marriage, female genital mutilation, and all kinds of SRHR problems were increased. They made headlines, but still everybody's attention was on the pandemic. So we kind of we were desperate, so we started preparing this podcast. So what we do at Tankwa, although it's digital and it's like it's a separate space. I like to call it's breaking the fourth wall. Like usually discussions about SRHR take place in four-walled rooms where other people can't like peek in. So we kind of broke the fourth wall and make it a stage for everyone to be part of. So what we do at Tankwa, although it's a digital thing, is we empower youth leaders because every one of us are young people. We grab the audience attention on SRHR topics and we engage and inspire. We provide accurate, competent, contextual information. We use technology, and we empower women at multiple levels. This is not these things are being done by many young people all around the world during the COVID era because of, as I say, because of the desperation and the increased reports of violations on sexual and reproductive health and rights. So it's not a new thing. I know I speak for everyone. I speak for every advocate, every youth advocate in the world when I say we do these things digitally. But I want us to stop here. Although digital movements such as Tankwa and many others are transformative in the post-COVID era. You guys, everyone remembers, I'm sure, the digital world allowed many young people to gather together as multiple assemblies, like the United Nations Assembly. In my association, the IFMSA had assemblies online, so many young people could take part in the discussion, trespassing the difficulties of transportation, the cost of transportation. It allowed a lot of people to the table, but I want us to remember that there are people we leave behind. That's the problem I want us to pose. That's the problem COVID poses by introducing the digital world. That is the concept, the digital divide. The digital divide is a term that refers to the gap between demographics and regions that have access to modern information and communication technology and those who don't or have restricted access to it. Here's a very beautiful map that I found, which shows the internet, the internet all over the world. As you can see, the northern part of the world is very wary to have a very rich access of internet, and everyone is enjoying the internet, while the southern part of the world is kind of dark and not getting the internet. This is very beautiful representation. So while taking the discussion digitally and while making things in the digital world, there are people we leave behind. Here are a few data. I believe in data so much. The first one is, according to UNESCO, only 55% of households globally have an internet connection. In the poorest countries, this percentage drops to below 20%. The second one is, globally, women are 23% less likely to have internet access than men. The third one is, a 1-hour Zoom call costs $4 in the US, but about $14 in Malawi. So the discussion, the digital divide, is not just about countries. It's not between developing and developed countries. It's about men and women. It's about urban and rural societies. So it's much bigger. It's much complicated than we can anticipate. There's my favorite quote of all time: "Nobody's free until everybody's free." And in taking the discussions to the digital world, as we do, we're doing that thing right now, taking the discussion of SRHR to the digital world online. There are people we leave behind, and I want us all to remember that this is although it's an opportunity, it is also a threat, because nobody's free until everybody's free. So I also wrote a few things that we can do. The first one is call for access to the internet. As we advocate for SRHR, for more rights and for accessible health, we should also call for access to the internet throughout the countries, throughout our continents, and we should also teach digital skills. Even if living in the cities, living in very big cities where internet is accessible, where mobile devices or any kind of devices are accessible, people still don't have the skills. So we should also teach the advocates these skills. The third one is to advocate. We should advocate. I mean, what else can we do as young people? We should advocate as many times as I can say it. So yeah, I suggest this. So thank you very much for listening. I hope I used my 7 minutes effectively. Okay, thank you.